Hi, I'm Dr. Scott Stoll. I want to tell you about a difficult patient. I'm here today with Dr. David Haase. You may know him. He's the founder of Maxwell Clinic and leader globally in functional medicine. You know, Dr. Haase, one of the things that I think people don't really understand, because we've not been taught as physicians and they don't understand it in general public, is that, you know, once you have an injury and you start taking medications for inflammation or pain, it can create this cascade of problems that spirals out of control and can lead to really extensive degenerative conditions. And you have a really profound story, and I think it would be important for people to hear that story and understand how important it is to pay attention to pain because it's an alarm signal. Mm-hmm. Treat it early, don't let it go long, and don't use medications to just treat pain. Mm-hmm. Would you share that with us?
Wow, absolutely. And it's fun because he's the hero of the story, actually. You always like asking me to tell this story. I get it.
Thank you.
But I actually had, I was very competitive, and I was at a conference where we got to hike the Grand Canyon. We hiked up the Grand Canyon. I raced a friend of mine. We got up to the top. We were so happy to see some green, wet grass, and I was going to run towards it and just enjoy that green, wet grass. And I jumped up, planted my feet down. It slipped out from underneath me, and boom, landed on the crux of my back. And I had a big injury. Didn't realize how significant it was at the time. Really didn't. And then I went into college. I developed really bad plantar fasciitis. Really bad plantar fasciitis. I mean, I had to carry something to sit on with me when I would be standing for any long periods of time. When I was in medical school, I couldn't wear the big white coat because you'd
remember the pockets.
Fill your front pockets with all the. Now medical students have it easy. They just have everything on one thing. But we had like all these books and like a whole exam kit in our right. But we'd put our stethoscope around our neck. And just that amount of weight on the back of my neck would put me into like 8 out of 10 pain. I couldn't think. And so I couldn't wear it. It was a weird problem. Everybody was like, what's wrong with you? But in the meantime, I had taken so much ibuprofen. Then I switched to naproxen because ibuprofen really wasn't cutting it for me. And then,
just thinking you're treating pain, right?
I'm treating pain.
Just trying to get through life.
I have pain. I treat pain. So there you go. Right? I diagnosed, I have pain. I treated, I have pain. And that was what I was taught, right? And then I started, I remember getting some lab tests done, and I had elevated liver enzymes. And I was like, well, what's going on with that? That was weird. And then I got, and turns out later, that was because I had developed so much leaky gut. I was having so much intestinal bacteria coming
from the anti-inflammatory medications.
Correct, yep. And then I developed huge gastritis, reflux. I started taking, first of all, like Pepcid, but then omeprazole had just come out, which was, Pepcid.
Yeah. Turn off the production of acid, right? Seems to make sense.
Prilosec. And then I started eating that. So I was eating naproxen, and then I was eating Prilosec. And then that led to B12 deficiencies. Right. I started having more nerve pain. Didn't know that was the case. Then I started, and that caused, oh my gosh, I had all kinds of fatigue, and the leaky gut that the anti-inflammatories really triggered led me down this path of autoimmunity. And I've had to struggle with all kinds of immune challenges. I mean, I say the good Lord gave me these things so I could learn from, so I could help other people. But then that goes on into more tissue problems. So make a long story short, and it's already a long story, and it's not short. You then treated my back. You did regenerative joint injections or facet injections in my back and help heal the ligaments that had been injured. And not only did I leave a 6 out of 10 pain in my life, my plantar fasciitis went away.
Amazing.
I mean, something I had been struggling with here for 30 years, gone. And I have total function. I can go walk barefoot without pain anymore. I don't have to use orthotics anymore. I mean, all of that. And I had given up on the anti-inflammatories a long time ago, and I take a really good care of my gut, and I do lots and lots of things so I can feel good and my gut can function well. But now I actually have the opportunity to heal even more and not have to compensate. So I got to be a poster child for finding and addressing the cause of the disease. And if you don't address these things early, the compensation for your pain, your suffering, your fatigue, whatever your symptom might be, that then causes more and more problems. So whatever folks who are listening to this, just honor your body. Be honest with your symptoms. Be honest with where you are in life, what's not functioning as it should be able to function, and find and address underlying causes. Because it has huge return on investment.
Yeah.
Huge return. And that's, I can't begin to believe how I'm more active now. I'm not afraid of working out like I used to be. I can, so there gets to be this virtuous cycle of health rather than that, declining health that we see so many people in. So anyway,
Yeah.
I want to say super thank you.
Oh, you're welcome.
It was, and
It's my greatest honor. And this is why we do what we do, right? And this is why we see life through a regenerative lens, because we can help people return to a joy-filled life.
because their bodies are designed to heal.
That's right.
Right? The body is designed to heal, and sometimes it needs a little help.
That's right. And we're here to give that little boost, right? And help people to find the underlying cause.
Yeah, yeah.
That's right. Well, thank you. Thank you, Dr. Hasse.
Thank you.
It's an amazing story.
Thank you.
Thank you. And if you want to learn more, please contact Maxwell Clinic today. We would love to work with you. We work as a team, and we assist the whole body, the whole person in healing.